Hello and welcome. Across India now, several lockdowns are coming into force, notably in the state of Maharashtra, which also has the highest number of cases by state across the country. Now, these lockdowns mean two things. One is it is a public health response in order to prevent people from getting out, mingling too much and spreading COVID-19 further. But equally, it has the impact on it impacts the economy and is now leading to what rating agency CRISIL is calling the second shock. And it's in a report titled as much, COVID-19 and its impact on economic activity in India. The CRISIL has said that few countries have escaped a second wave of the COVID-19 pandemic, and it's India's turn now, with daily cases, of course, crossing the previous peak of September 2020. Note that we are now at over 126,000 cases daily, and the sharp jump actually only came as recently as the last week of March. So the question now is, or the questions now are as follows. One is, what is the kind of economic damage that we are going to see, not so much because of the pandemic itself, but because of the lockdowns that we are once again initiating, and what does this do to the numbers that we started out with? Secondly, where are we in public health response? There are two responses. One is to obviously prevent the spread of the disease further, but equally the pace of vaccination, which shall hopefully even out things over time. So on both sets of questions, we are obviously not very clear where this is headed, but let's find out from two of our experts, DK Joshi, Chief Economist at CRISIL, and Dr. Ishwar Gilada, Infectious Diseases Specialist, also both based in Mumbai. And Dr. Gilada is someone who is very well known for his work against AIDS. Thank you both for joining me. Dr. Gilada, let me begin with you from a public health point of view. Where do we stand today, given the two or three things that are happening simultaneously? The disease is spreading still. People are landing up in hospitals. There are no space in hospitals. At the same time, we are obviously trying to step up the vaccination efforts.
See, we must understand one thing, that we are in the second phase of pandemic. And if we did not presume that we will be in second phase, we are in fool's paradise. So wherever we have seen second wave, it is much stronger than the first wave. Where we are seeing the third wave, stronger than the first and second wave. So obviously our second wave is stronger than the first wave, number one. Number two, currently this virus is a highly infectious virus but less lethal. So it is bound to have more and more cases. And currently we are, yesterday we reported 125,000 cases in India, but we might be going to almost 250,000 in just 10-15 days. Thirdly, people are talking about Maharashtra. Don't go by numbers. Don't go by percentage of increase. Maharashtra was contributing 70% of cases 20 days back. Maharashtra contributed 45% cases yesterday. That means there is a 25% gap. And this gap is filled by some of the states which are adjoining Maharashtra, like Chhattisgarh, Madhya Pradesh, Gujarat, Karnataka. I'll give you an example of two more states, UP and Bihar. On 10th of March, UP had only 121 cases. Yesterday it had 6,000 plus cases. So that is 50 times jump in 25 days. Bihar had only 44 cases on 10th of March. Yesterday they were 1,500 plus. So that means there is a 35 times jump. Maharashtra jumped only 4 times. I'm not taking side of Maharashtra, but if you are talking about economic impact, we should put the figures correctly. Secondly, the country of the size of India, 140 crore people, is bound to be number 2, number 3, number 1 in many health problems, many other problems. So rather than putting in numbers, we should put the ranking based on cases per million and deaths per million. If you rank India in 210 countries, it is ranking 120 in number of deaths per million, and is ranking 125 in number of cases per million. So the moment you start putting the like that, then the economic impact and the projecting India as a very bad country, it will stop automatically. Now, your last question was that where are we in vaccination? You must understand the current vaccination pace, whatever pace it is now, it has to be many-fold more. And if at all it is increased, it is to prevent third wave, not second wave. So vaccines impact will be there only after 6 to 8 weeks after the first dose and 2 weeks after the second dose. So a minimum 2.5 months are required to have an impact of vaccination, which is going on currently. So that is only to prevent third wave. Lastly, most importantly, we have to have look at mask, test, treat and track, and vaccination. So MTV, vaccination is last, not the first. Masking is the first.
Okay, got it. Okay, I'll come back to that in a moment. DKG, can you tell me now how are you seeing the numbers and what the projections at the early part of this year, and that is only a few weeks ago, were obviously a lot more optimistic in terms of where India's economy would be because they assumed that we were leveling off at only a few thousand cases a day and things would settle down. But clearly that's not the case.
Yeah, true. I mean, it's deja vu in some sense. I mean, last April, I think we were worried about the first wave. If I take you back to the April 2020, I think similar concerns, and now I think we are facing the second one. So I would summarize it in 4 words. I mean, there was surprise, there is uncertainty, there's a downside risk, and frequent changes in economic outlook. And as you rightly said, I mean, we will see all of them play out. But I think I agree. I mean, we also looked at the data, and as Dr. Gilada was also pointing out, that second wave is typically much stronger than the first wave, and but the economic impact is not that pronounced. I mean, and because one, people learn to live with the virus, and I think they know how. I mean, they learn how to work their way around. The fear factor is not that much. And the experience of United States, Europe, I mean, who have already had the second wave, tells you that particularly the manufacturing sector is reasonably well placed. I mean, to weather the second wave. I think it's the worry is more on the contact based services like tourism or your restaurants, hospitality. These were anyway struggling, I think, for the last 1 year. I mean, they were hoping to come out, and the second wave actually hits them even harder. So I would say that in terms of overall growth, the impact will be much less pronounced than the first wave. But the inequalities in the system could continue, because I think the segments which were hurt earlier are going to be hurt again this time around as well.
And how are you looking at the impact of lockdown? For instance, Maharashtra is into a full weekend lockdown. Many other states are announcing some versions of lockdown on the other. While other days they may not be a full lockdown, but there's definitely a lot of restrictions. Offices are shut. Private sector offices are shut. So all of that is bound to have some impact, won't it?
Yeah, absolutely. I mean, see, what we look at these days typically is the Google mobility indicators, and they are already beginning to dive down. I mean, and for states like Maharashtra, they are coming down faster. So that's the first indicator. It's available on a daily basis, and it kind of correlates with economic activity. But I think I must point out, I mean, I still remember in the first lockdown when it was complete lockdown, I mean, all these hawkers, etc., had disappeared. I think now this time it's not the case. I think they are still operative. I mean, so it's not the intensity is. I mean, particularly for the vulnerable sections is not of the lockdown is not that deep. I mean, yes. I mean, as I said, the services, the dichotomy in the economy, services versus manufacturing, small versus large. I think all these will get more pronounced. I mean, that's what we think.
And any early thoughts on what this could be in terms of numbers? I mean, we are really talking now about the first quarter of the 21-22 financial year versus the last quarter of the 2021 financial year. Now, is this likely to be different from earlier projections, and to what extent?
Well, obviously, I mean, April will be hit, I mean, looks like, and then depending on how it plays out, as I said, there is a huge amount of uncertainty associated with how the lockdowns will proceed, etc., how this virus will spread. I mean, last time the rural area was not that badly hit, but if this time around it goes to the rural areas, then you have a different kind of a scenario playing out, and we don't know much about that. So I think coming out with numbers which are reliable, I think, is extremely difficult. So our forecast currently for the year as a whole, 21-22, is 11% GDP growth, which is a little lower than what the multilaterals and some others, as you rightly said, some people had pumped up their numbers. Now, I think there is a downside to that number, I would say, but how much, I have no ability to assess as of now. I mean, as things progress, as the virus plays out and the lockdowns are implemented, I think, because that's the only prophylactic till the time you have herd immunity. So I think all that will impact economic activity. So I think in terms of overall growth, the impact will not be as pronounced as the last year. But in terms of inequalities, I think it could still be, I think, as pronounced as it was last year.
Right, and if you're saying you had projected 11%, and that 11% is obviously on a very small base, that
That's
itself
right.
is likely to come down, right? And that's
No,
bound to happen.
there is a downside risk to that. We will have to see, because I think if you get, I think Dr. Gilada would be much better placed to say that. But if you do get some herd immunity and impact of vaccination in the second half, then you will see some of these activities which are very weak right now also surge. I mean, so that's so we
Right.
have to watch and play out. I mean, right now we are giving a guidance that there is a downside risk to this number.
Right. Okay. And that's a good point to take it across to Dr. Gilada. So we are looking at April, May, June is the first quarter of the current financial year, which looks like it is under pressure. But Dr. Gilada, you were saying that the vaccination and all the other efforts that we'll do will hopefully start taking effect in the second quarter, which is maybe July onwards. So could one say that whatever happens, the worst could be over by June, or is that too ambitious projection?
Basically, we should not expect any worst, because current strain of the virus, as I said earlier, is a highly infectious but less lethal. People are not going to die. People are not going to be seriously ill. Whatever hospitalization we are seeing full, they are not truly full, because there is a lot of rush from the patient side, and a lot of doctors are admitting patients which are not requiring hospitalization. A lot of injections are administered when it is not required. So the medical side is totally different than what it is projected currently. But Mr. Joshi has raised the issue of herd immunity. We actually, there is nothing like herd immunity. We used to think that herd immunity will be one thing which will be required. If we go by that, till January or February, we had 55%, 60% of people who were testing in our clinic not coming for COVID. They were already antibody positive, so they were already infected. Despite that, we are seeing a lot of infections happening. So we do not know whether having infection in the past, that is protecting. It is not protecting. Taking injection, people are taking 2 doses of vaccine. After that, also people are getting infection. We do not know whether that is causing herd immunity. So herd immunity is quite ununderstood in this COVID. The virus is very difficult to understand. It's changing its behavior so often. So I think market, as you say, I do not understand market, but it is inversely proportional to the number of cases. If the cases are lower, market is up. The cases are up, market is low. But we need to tell people that nothing to worry about cases. It is going to happen. The graph is going to grow further, but people are not going to die in that numbers, because we were looking at 3.5% death rate, or it's called CFR, case fatality rate, earlier in Maharashtra. Currently it is 0.7%. So it has come down by 1/5. So even if cases rises by twice or thrice, still we are going to see less deaths and less serious illnesses.
Right, but when you said that we could go to 250,000, did you mean that we would peak out at 250,000? I mean, just as an estimate, or could it keep rising?
Again, we cannot say anything about this virus. But looking at the trend of current graph and how it is likely to stabilize, like for example, in Maharashtra, we are now 55,000, 57,000, 50,000, 45,000, in that range. It is not crossing 60,000. Though tests are done, about 2 lakh tests are done every day. So percentage yield of how many tests are done, how many are coming positive, it is remaining same. So possibly in next 2 weeks or so, we may attain peak. But when we attain the peak, other states may have a surge. So it could be a different peak in Maharashtra, different peaks in other states. But in Maharashtra, possibly peak could be in next 2 weeks or so.
Right. So, Mr. Joshi, so the one of the points that I think you had mentioned when you did a similar study in the peak of the 2020 COVID-19 cases was how it was being how the distribution was happening by economically advanced regions versus not so economically advanced regions, and that in turn has obviously an impact on the way growth numbers or economic growth pans out. How is it looking to you now?
Well, I think it's the same scenario playing out. I mean, Maharashtra, Gujarat, I think these are the states which are economically stronger, registering higher growth, and I think Karnataka for that matter. So I think it looks similar in nature, and I think the spread of the disease doesn't seem to be that much in poorer states like Bihar, UP, etc. So it is concentrated in or at least it's beginning from the richer states.
Right, and do you feel that I mean, will have a disproportionate impact on economic growth like it did last time, or?
Well, I think hard to say right now. I think because
Right.
as doctor was saying, it's so unpredictable. I mean, I think and last year was full of surprises for all economic forecasters. I mean, they had to revise their numbers, not in small measure, but quite drastically. I think first it was downward revision and then it was upward revision. So I won't stick my neck out too much on that. I mean, because I'm not
Right.
too sure how it will play out.
Right. So, Dr. Gilada, one reason or key reason that we are seeing this dramatic spread is behavior. Now, the lockdown is also an attempt to influence behavior, obviously by keeping people bound to one place. Now, what's your sense in terms of where we are right now? I mean, at least if you look at states like Maharashtra or even other places like Delhi, state and city, which have responded with some kind of curtailing of movement. Is that likely to stop things where they are, or have we in some ways let the horse already bolt from the stable? Because this happened, the cases that we are seeing today have obviously been contracted maybe 15 days ago or more.
You see, all the infections particularly are depending on a disease triangle called host, parasite and environment. So it depends on host behavior, it depends on parasite behavior or virus behavior, and it is environment. I'm not going to go to environment, but we really cannot blame only human behavior, because human behavior has not radically changed. Human behavior, our 40% masking has not gone to 60% earlier and gone down again for 40%. It has been remaining 40-45%. So when virus was little weaker, about 3 or 4 months before, we were reporting very less cases. But now virus has become very stronger and having more infections. So possibly, rather than blaming the human behavior, we should blame the virus, if at all. Secondly, this lockdown impact is a psychosocial impact. Yes, people who are going to go out casually for food or meeting some friends and family, they will not go out. So that psychosocial impact is there, and probably that is the only administrative decision or political decision to keep that psychosocial impact. Otherwise, it doesn't change any spread of infection.
Right. And last set of questions, let me come back to you, Dr. Gilada. So what's your sense in terms of our medical preparedness this time? I mean, I know you've been saying that our case fatality is low, the severity of the infection is less. At the same time, I mean, there are people who are, landing up in hospitals, and many of them are reaching the ICU or even for that matter, the ventilator. And unlike maybe last time, many of us know many of these patients now. So are we medically prepared? Do we have enough drugs and medicines to battle this?
You see, we are medically prepared, number one. We are better equipped than last time, number two. Number three, why there is a shortage? Because last time they had acquired a lot of private hospitals COVID, and made them COVID beds. It has not been done this time. It has been done very recently. There is no shortage of drugs, but whatever shortage is created is a artificial shortage. Government of India can issue a compulsory license for this remdesivir. Once that is done, there will be many more players which will produce that drug, and the drug cost can go down. So it is in hands of Government of India using this opportunity of the COVID and issue a compulsory license so that the whichever drugs are available, they can be made easily available. There is no role of tocilizumab. There is no role of any other drug than remdesivir and steroid. Steroid, they are in plenty and they are at very much cost effectiveness. Remdesivir, there is a shortage little bit in Maharashtra, but possibly some holes are plugged recently. And there can be a DPCO, there is a drug price control order, where they can bring this product under DPCO so that hoarding can stop. Currently, there's a margin between supply at the stockist level is 1,000 rupees to 5,800 as a MRP. So if you reduce MRP to 2,000 or so, applying DPCO, then it can be always managed. So I think we are managing well. There has to be some good coordination between state and center, and they should also listen to public health authorities or experts so that things can be managed properly.
Right. So open up remdesivir production to more manufacturers, right? That's what you're saying?
Yeah.
Okay, got it. Mr. Joshi, last question to you. So I asked you about economic growth as an overall figure, but what's your sense on when you look at the demand numbers or investment intentions that may have started, fructifying today, but perhaps they will get postponed or may get pushed maybe to the end of the year or even later?
Well, I think the most of the investment would be from the public sector, which is the government, and I think the state governments have also planned higher investments in the coming fiscal. I think many of them can be pushed. I mean, they like road construction, etc. These activities, as I said, you have learned to negotiate around the virus a little better. But yet, I mean, if you have lockdowns, etc., there will be some implication of that. I mean, there could be implication on the labor availability also that we had last time. But having said that, I think I will still say that it will be less pronounced compared to last year, and the ability to invest will also depend on whether you have the adequate funds, the projects are ready, and so on and so forth. I mean, we do expect investments to do much better this year compared to last year, because I think there are many projects in the pipeline, and I think some of the things are working reasonably well, and particularly for some of the segments where PLI scheme has been announced, I think that will also give some fillip to private sector to participate in the investment story to some extent. Yeah, I think the virus will, of course, I mean, it will make it the path a little rocky, I mean, so to say. But nevertheless, I think the investment momentum would be much better than last year.
Right, gentlemen, we've run out of time. DK Joshi, Dr. Ishwar Gilada, thank you so much for joining me, and hope to come back to you soon again.
Thank you.